Welcome everyone to today's lesson. Today we will be going over the musculoskeletal system. Finally, I can pronounce it correctly. The musculoskeletal system is composed of the muscular and skeletal systems. We will be learning more about it on the next slide. On to you, Celine.
All right. So first off, we're just going to do a brief overview of what we're going to be talking about. So first things first, we're going to talk about what is this system. Now, unlike William, I cannot pronounce this, so I'll be referring to them as two separate things, muscular and skeletal, because I cannot put them together. We're going to be talking about what they do and how it works. Next, we're also going to go more in detail and more in depth about it. And we'll first go like a brief overview of the whole entire system. Then we're going to talk about the muscular system as just one entity. Then we're going to talk about the skeletal system. And lastly, we're going to talk about some common diseases that can be found.
Before we move on, are there any questions, you guys? Questions for us? No questions so far? All right then. You guys might be asking us, well, what in the world is the musculoskeletal system? This is such a mouthful. Why do I need to know about it? And what in the world does it do? Well, to start us off, your body is a constantly moving form. We move every day, whether it be walking or talking as I'm doing now. For talking, I need to use my jaw muscles, which is held up with your muscles and your bones. I want you guys to think about it. If we didn't have our muscular system, we would be a rigid statue. Unfortunately, a skeleton can't move by itself, unlike the skeletons you see in Hollywood blockbusters and whatnot. Those skeletons can move, unfortunately. A skeleton alone in the real world cannot move. So, your body uses your muscles to move around freely. Otherwise, you can't move. Whether it be walking to school every day, which some of us do, some of us don't anymore, controlling your fingers while typing and eating, or or whether it be positioning a leg for a perfect soccer kick. Meanwhile, you might be asking us, well, William, Celine, so if we have our muscles, we can move around, right? So what's the use of the skeleton? We don't even need our skeleton, right? Well, that's not true. The skeleton is just as important. If we only had muscles, we would all be big blobs on the ground because the skeleton is just like the support of a tent. You guys, how many of you guys have gone camping before? Then if you've gone camping, you've probably stayed in a tent. And if you ever helped your parents set up a tent, there are these metal bars inside the tent. Those bars are to help the tent maintain its shape. Otherwise, the tent would be just a pile of fabric sitting on the ground, and you would use a tent more as a sleeping bag rather than sleep in the tent. And now let's apply that example to our own body. If we didn't have our skeleton, we would be a bunch of skin and muscles on the ground. That doesn't sound very appealing, doesn't it?
And for caveman language, in case anybody wants to know, Peppa Pig. Muscle, skeleton, Peppa Pig. No muscle and skeleton, bacon. End of story. And with that being said, we're going to move on. So now we're going to go a little more into depth about the muscular system. So the muscular system is made up of your body's muscles. As you can see, there's this creepy man alien looking thing. Well, that's your muscles. Don't worry, it's not going to come haunt you in your sleep. And the movement is the primary function of the muscular system. Muscles are not only all over the body, they are also found deep within. All muscles fit into one of these three types: skeletal, smooth, and cardiac. And we'll go more into detail about how each of these categories fit into muscles and how they work in our following slides. With that being said, let's first talk about skeletal muscles. Skeletal muscles are the most common type, and they're usually attached to your bones. and are under conscious voluntary control. Does anyone understand what voluntary control means or no?
First of all, before anyone answers that question, Peyton, you have your hand raised. Did you want to say something?
Like I never saw some people and two people in here.
Sorry, what?
Hmm?
There are there are like two persons that I never met in this class
That,
before.
Oh, uh-huh. Yeah, so basically today we're going to have a guest speaker come, and William invited some of his friends to come join in and listen to our guest speaker talk. Does that make sense? Does that answer your question? Yes, Peyton?
Yes.
Okay. So, Peyton, can you also answer what a voluntary muscle is? Like, not voluntary muscle, voluntary control. Can you explain to us what that means? It's okay if you don't know, just try.
I see Serena's hand up. Serena, would you like to answer this question?
What did you just say?
Would you like to answer what conscious or voluntary means? Do you know what that means?
Uh,
Sure. I could try.
mhm.
Oh, go ahead.
I think it means like optional.
Optional.
Hmm. Great answer, Serena. Great job. We can take answers for later on, but for right now, we're just going to take Serena's answer. So, Serena, you're on the right track. You're very, very close, but the tiny bit of difference is voluntary control is when you have to think about it. Your brain has to tell you, okay, I have to do this. Involuntary is when you just kind of your brain doesn't need to think about it. For example, when your heart pumps, you don't have to think, oh yeah, I'm taking a test. Oh wait, oh my gosh, I forgot to have my heart pump. If you had to do that, you would probably be dead in a grave right now, which is what we not what we want. But with that being said, does that make sense, Serena? Serena, does that make sense to you?
Yes, it makes sense.
Okay, great. Then we're going to be moving on to the next slide.
Yes, so on the third slide that everyone saw, those examples that I put in, like playing the piano, eating, walking, or even speaking, these are these are all movements of your skeletal muscles. These are the muscles that we can think to control. Meanwhile, let's look at the next two muscle types. There are smooth muscles and cardiac muscles, and they have one big similarity. We will get to that similarity, but first let's look at the smooth muscles. Many smooth muscles are inside the body and you can't see them on the outside. So you can't see a muscle like my bicep here. My bicep, the bicep is a skeletal muscle. So most of the skeletal muscles you can see, but most of the smooth muscles, however, you can't see them because they're inside the body. And they're also under involuntary control. The muscle cells in your stomach, blood vessels, and intestines, if you were here for the digestive system lesson, you also know that the esophagus cells have smooth muscle cells. These are all made up of smooth muscles because they need to push and relax and contract, but you don't think about your stomach pushing food into your intestines, and feel you don't think about your intestines moving your food around, and you certainly don't need to think about blood going down a vein or an artery in order to make it happen. Meanwhile, we also have the cardiac muscles, and these are only found in one place in the body. And I would like to give a hint to where that one place is. Because cardiac, if we break that word apart, the front of it, it sounds like cardio, and cardio is the Greek word for heart. So, as you guys now know, cardiac muscles are the muscles found in your heart. Your heart muscles now, they are responsible for the powerful contractions and relaxations of the heart. Now, I want everyone to either take 3 fingers and place them on the side of your neck, or 2 fingers and place them on the joint between your palm and just on your wrist. 2 fingers on your wrist or 3 fingers on the side of your neck. Slowly adjust where you put these fingers until you find a gentle throbbing. If you find that throbbing, you are feeling the beating of your heart, which is also the contractions and the relaxations of cardiac muscle. Slowly try to find that pulse. Yeah, so that is the beating of your heart. Your cardiac muscles are very strong because they need to pump all that blood to your important organs. And also, they are under involuntary control. That was the one big similarity between smooth muscles and cardiac muscles, was that they're under involuntary control. Who has ever thought during an important math test, oh, I need to pump my heart so that every part of my body is supplied with oxygen? Have any of you thought of that before? No. I
No.
see I see aggressive heads shaking. Well, that's true. You don't need to think about your heart beating in order to keep you alive during a math test. It just happens.
Okay, so I think I just saw our guest speaker come in the waiting room. So we're gonna try to finish this, but if we can't, then of course it's all right. So now let's talk about the skeletal system. So this is where Mr. Skeleton comes in. So you guys know how you guys all made those crafts with skeletons, like the one William is showing. I believe Peyton also made one. Yeah. So that is your skeletal system. And you might be curious, what the heck does a skeletal system do? Well, let's talk about it. Your skeleton has many functions, supporting the body, protecting internal organs, movement, mineral storage, and production of blood cells. Now, bones protect the fragile organs of our body. For example, do you see over here, and let me take out my laser pointer, do you see how there's this rib cage? Well, that protects your lungs, correct? All right, now, bones store minerals, especially calcium and salts. But we have to also keep in mind that bones are kind of made of minerals. So it goes both ways. And blood cells are formed in bone marrow, and William will show you guys how that works on the next slide. Kids have about 300 bones when they are born. There are 206 bones total in the adult skeleton. Now you might be wondering, what? That doesn't make sense. How come kids have more bones than an adult does? Well, we'll talk about that too. And it starts with an O and it's called ossification.
Yeah. Before we move on, guys, I have one thing to add on. You guys have probably heard your parents say, at least they did to me, drink your milk. Have your calcium. You need to get your calcium. Drink your milk. You guys probably are wondering why we have 300 bones when we are born and 206 when we mature. It's ossification, and it's not by breaking bones. We don't lose bones by breaking bones.
Mm-hmm. And we'll be explaining ossification on the next slide.
Yes. Everyone, let's dive into the bone now. Just one single bone. I think this is the femur, which is the largest bone in the body. It's not your spinal cord. Let me show you guys where the femur bone is. When I stand up, it's the bone right here that connects my hip bone, also called the pelvis, to your tibia and fibula, which are the lower leg bones. Bones are largely made up of calcium, which was why, now I understand, which was why my parents were why they cared so much about if I had enough calcium or not. And the outermost layer of the bone is tough and hard. It's called periosteum, and periosteum is a connective tissue that helps bones connect to each other, although part of that was is made possible by your joints, your cartilage, and also your synovial fluid, but those we won't get to in this class. That's a little way too advanced. And moving on. A thick layer of compact bone lies underneath the periosteum, and this compact bone is usually what we think about when we think about bones. It's that tough, hard bone, but it's actually not that tough and hard. This is why. There are a series of holes that run through the compact bone, and these holes are very small. These holes are also called the Haversian canals, and the Haversian canals are filled. These little holes, they're not formed when you fall or anything. They just naturally are there. And these little holes, they are filled with nerves and blood vessels to supply your bones with the nutrients that they need. And the innermost layer is marrow, where blood cells are produced. There are two types of marrow actually inside the bone: red marrow and yellow marrow. One type produces blood cells, one type does not. Red marrow produces blood cells. It produces red blood cells, white blood cells, and platelets, which help clot any injury on the body. Meanwhile, yellow marrow is just a storage for fat cells. And moving on to why we have 300 bones when we were born, but only 206 when we grow up. It's because we're born with lots of cartilage and fragmented bones. When we are born, our skull is actually a bunch of fragments. It's not one big bone that protects the brain. It's a bunch of pieces of bone surrounded by cartilage. But slowly, cartilage is replaced with bone through ossification, which needs calcium to happen. When you mature, slowly this cartilage turns into bone.
Okay, so lastly, we want to talk about the diseases of the See, I can never pronounce it together, so I'll be pronouncing it separately. The muscular and skeletal system. So first off, let's talk about muscular dystrophy. So this is actually a very rare kind of disease, and it's mostly more common in boys than in girls. Now, a group of inherited diseases that cause progressive weakness and loss of muscle mass. And let's keep in mind, it's very, very rare and it's very unlikely to happen, but it can happen in some cases. And it can lead to a shortened lifespan and heart problems as well. And moving on, we have osteoporosis. So, osteoporosis is a condition in which bones become weak and brittle. The body constantly absorbs and replaces bone tissue. With osteoporosis, however, new bone creation doesn't keep up with old removal. So, that means essentially it's not keeping up with the new bone creation doesn't keep up with the amount of old bone removal. And now this one, unlike muscular dystrophy, is very, very common. And lastly, let's talk about rickets. So rickets, it kind of sounds like crickets, nothing related to it though. Rickets is a bone disease that affects children and is the weakening of bones caused by vitamin D deficiency. And where do we get our vitamin D, you may ask? Well, out in the sun. So that means if you don't get enough vitamin D or you have a vitamin D deficiency, you might get rickets. So, what does vitamin D deficiency mean? Well, it can't fully absorb calcium and other nutrients essential to building bone density and mass. This leads to a softening or weakening of the bone structure overall, which can often cause easy breaks and fractures. With that being said, is there anything else we would like to know before we move on to a
One quick
test?
thing to add, Celine. Thank you for that informative talk on what some of the more dangerous and some of the more common diseases of the musculoskeletal system are. Muscular dystrophy, you guys really shouldn't worry about this. This is inherited, which means you can only get it. It's not transmitted. You can't get it from another person. You get it from the genes that your parents pass on to you. Now, you guys might be asking me, why does muscular dystrophy lead to shortened lifespan? That's because when you're born with muscular dystrophy, phase one of it usually means that your muscles are weak. You can't run as far as other people. You can't use your muscles as much. They're weaker muscles. But in the later stages of muscular dystrophy, this is when you age. In the later stages, your muscles start to break down and they can't function properly. And remember, some of the most important muscles are your vital organs. You can't breathe properly because some cells in your lungs are muscles. Your blood can't be filled and pumped with oxygen because your heart is a muscle itself, and you can't move anywhere. And in the end, you can't eat anything because your esophagus and stomach muscles fail. So this is why it can lead to shortened lifespan. Now, osteoporosis. You guys shouldn't be worrying about this one too much. It is super common. I think there are millions of cases per year, especially in senior citizens. My own grandma has osteoporosis, and what simply happens is that the bones become weak. When you're running out in the field and maybe you trip and fall, the most you may get is a bruise, or maybe in some severe cases, your your knee may bleed, your arm may bleed. But let's say for senior citizens, if they trip and fall, consequences, especially if they have osteoporosis, consequences could be much more dire, which means bad. And they could be breaking several bones as opposed to us just getting a few bruises. And rickets, guys, this is why your parents want you to get away from screens and go out to play, maybe once in a while or maybe every day. It's because you get vitamin D from the sun. And vitamin D helps your body absorb nutrients and use minerals, because otherwise you can't absorb minerals or nutrients. So you need that vitamin D to help you absorb these nutrients. S- So pretty much rickets happens when you don't have enough vitamin D. Yes, Ethan.
Also, your parents give you milk. It also has vitamin D.
Yeah.
Okay, with that being said, I think our lesson has finished. So I'll go ahead and introduce our guest speaker for today. But before we do so, I'm going to go on to this slide. So over here, William has prepared some possible questions we can ask. This is just kind of giving you guys some ideas for questions you can ask. And with that being said, I'll go ahead and introduce our guest speaker for today. So our guest speaker for today, you can address him as Dr. Wu or however he wants you to address him, and he'll give himself a self introduction afterwards. But I'll go for him really quick. So, Dr. Wu is a well known and experienced oncologist affiliated with hospitals in Nevada, meaning he diagnoses and treats cancers of all kinds. He has over 2 decades of medical experience, and he received his medical degree from Anhui Medical University, a prestigious school in China. Today, he will be giving a talk on his field of study. If you have any questions for him, make sure to write it down on a notebook. Try not to write it in the chat because that might interfere with his talk. And then we'll give you a Q&A period later on where you can ask him questions. And with that being said, let's all give him a warm welcome, please.
Hello.
Hello.
Hi.
Yeah.
Can you see me?
Yeah, we can see you.
Yeah.
All right. Good afternoon.
Good afternoon.
How are you guys doing? Looks like you guys doing well. I actually I heard just about 10 minutes all you guys talk and discussions and questions. Very interesting. I'm Shanto Wu. My last name is Wu. The first name all call me Dr. Wu or Tim Wu. Okay, the first name is Tim, T-I-M. Very simple. I'm a medical oncologist. Has been in Las Vegas, Nevada for 15 years. I'm an oncologist. That means is specialized doctor, internal medicine doctor, to take care of patients with cancer. Why I'm going to say I'm an internal medicine doctor called medical oncologist. There is other two types of doctor also take care of cancer patients called surgical oncologist. Basically, it's a surgeon. They operate on the patients, remove the tumor. Also, there is a third type of cancer doctor called radiation oncologist. Radiation oncologist means the doctor who use radiation as a tool to treat, take care of cancer patients. Very often, three types of doctors work together in order to better take care of the patients. I'm a medical oncologist or oncologist, basically use non-surgical treatment, take care of the patients. So first of all, I just want to ask you questions. Do you guys understand what means the cancer? What's the differences between cancer cells and the normal cells? That's the first thing we need to think about it and try to understand it. We all know we have a body, different type of organs, right? Like brain, skin, liver, bones, hair, all this tissue or organs is composed of cells. Cells is a small unit, functional unit. It's most important for your organ, for your body. Anytime the cells has born and mature and die off. So normally in your body, your cell is not permanent. Even though you cannot see, that's your liver. Actually, 3 years ago, your liver is different from 3 years later, your liver. Even though if you look at the liver size and shape, it looks the same. But as a matter of fact, the cell, the previous liver cell already mature and die off, have a new liver cell grow back to replace them. That's how normal cell lifetime and grow, mature, and die off. That's a normal process. All your body cells do the exactly same thing, called cell cycles. But a cancer cell is different. Cancer cell is a normal cell, has acquired mutation. What mean acquired mutation? For whatever reason, the cancer cell, the DNA, the genes in the nucleus, the genes mutated. The genes become abnormal, make the cell continue growing and never die off. So the cancer cell actually, they grow forever. That's abnormal, right? Normally we should have grow, mature, and die off. That's how the normal cell life cycles. But once a cell become permanent, never die off, their behavior also change. They become very, very aggressive. They start to moving around. We call them metastasis. Hello? So the first thing we need to understand, what's a cancer cell? Cancer cell basically is a normal cell, acquired a mutation in the genes, and become out of control of growth and continue to live forever. Also, cancer cell behavior change. They start to invade and spread, and also moving follow the blood flow or your lymphatic tissues. We call spread or call metastasis. There is a term called metastasis. So the next question you can ask me, why cell have mutation? How this mutation can happen? Well, that's a very complicated questions, but with the last 50 years study research, now we know a lot. Now we learn most of the time, the normal cell during the maturation and die off during the process, for whatever reasons, the genes acquired mutation by just because of cell itself dividing, DNA dividing, made a mistake, we call error, or by other factors. Most common factor we understand, like radiation. You guys probably read some of the novels or some of news. In Second World War, in Japan, have 2 nuclear bombs were blasted. After the nuclear bomb blasted, few years later, like 3 years or 10 years later, there was lots of people who survived or were survivor, developed leukemia and all type of cancer. That is because of a nuclear bomb blaster create radiation. The radiation damage your genes, DNA genes, and later on can cause cancer. Another example is radiation from sunshine. When you expose yourself, go to beach with your parents or your friends, get a sunburn, right? Particularly when you're young, like a teenager, like 10 years old, you really lots of time spent play around in the sunshine or on the beach, and you get a sunburn. Each time you get a sunburn, basically you got UV radiation damage some of your skin cells, and some of those skin cells may have a mutation or acquired DNA mutation. When you grow up, like 30 years old, 40 years old, start to have skin cancer. One type of skin cancer called melanoma. Have you heard? That's directly related to sunshine. There is other reasons can cause it too. Let's see, hormonal. We know the cancer patient, let's see, woman with breast cancer related to hormone. People taking estrogen, progesterones. That's a normal hormone produced by ovaries to maintain the person like a woman. And there is a male, we call prostate cancer, developed prostate cancer, also related to hormone for male, which is androgen. People use this hormonal products significantly increase the risk of breast cancer in women and prostate cancer in men. This is all we know, these factors, but there is a lot of factor, actually 50 to 70% of factor we still don't know. But we know is gene mutation cause the cell out of control of growth and become cancer. All type of organs in the body can have cancer. That's why we have skin cancer, we have liver cancer, pancreatic cancer, we have bone cancer, we have blood cancer. Once you have blood cancer, we call leukemia. You guys probably heard leukemia is very common. It's actually is number 1 most common cancer in children for both girls and boys. The next question I want to talk about how to prevent cancer. Cancer treatment is very, very difficult. Once you have cancer, you want to cure, it's very, very hard. Even though we have a multiple specialty involved, surgical oncologist, surgeon, and radiation oncologist or medical oncologist will use different type of treatment, but the cure is still very difficult. This is why we still recommend the prevention and early detection of cancer is most important This two approach is most important to prevent cancer and also detect early, and early detections can be cured. Most of cancer can be cured. This is why we do mammogram for women. Any female age more than 40 years old in the United States automatically getting mammogram once a year or once every 2 years. Same thing with other type of cancer, like prostate cancer, we do screening, right? We want to detect early. Lung cancer, we do CT scan, CAT scan, PET scan to screen early stage lung cancer. Let's see if somebody is a heavy smoker, right? You smoke 1 pack a day for 30 years. In that case, that person has significantly increased the risk of lung cancer. In that case, we do a scan of the lung, do a CT scan of the lung, or do PET scan of the lung. We can detect it early. And if it's early stage, like stage 1 or 2, we do surgery, radiation treatment, plus internal medicine doctor, oncologist like us give chemotherapy or targeted therapy, and that patient can be cured. So that's why we do all this preventions and early detection. Preventions including don't stay away from the sunshine, right? Try not to get a sunburn, and you need to get sunscreen, stay in the shade. Make sure don't get a sunburn. The sunburn is bad for your skin and is a risk for your skin cancer. In terms of treatment, it totally depends on stage. I already mentioned stage 1 or 2, we do surgery, remove the tumor. Like let's say you have lung cancer, we do surgery, remove the lung cancer, the lung tumor, which is, of course, we have to determine its early stage. That means the cancer not spreading. If a cancer from the lung, let's say right lung, already spread to liver or spread to brain, that's a stage 4. That type of cancer, we never can cure it. Unfortunately, we cannot. Even though we give all sorts of treatment, we cannot cure it. But if it's stage 1, stage 2, that means the cancer stay in the lung, let's say right lung, upper part of the lung, we still can do surgery, remove it. After the surgery, remove it, and patients, the wound is healed, we give radiation treatment to radiate the local area. Just try to kill any possible or probable left behind cancer cell, which we cannot see, we cannot remove it. Then, after radiation, we can give chemotherapy or give other targeted therapy, which is specifically treated for the gene mutation. In that medicine was delivered by me, the gene therapy or targeted therapy, immune therapy, which is usually immune system to boost our patient immune system, try to kill the cancer cell left behind after surgery. That was delivered by internal medicine oncologist, doctor called medical oncologist, by me. So we do a lot of new treatment in last 20 or 30 years. This is a typical example of why get 3 doctors involved. Try to increase the chance of cure. Even with it being said, unfortunately, even stage 1 or 2 early stage lung cancer, with all sorts of treatment given to the patient, it's not 100% cure. We can get in somewhere as high as 60, 70% cure. And another 40%, 30% people within 3 years or 5 years going to die of cancer. That's how bad of this disease is. So again, go back to initial we discussed. Most important is prevention and early detection. Once you reach the stage 3 or late stage, as I said, spread, metastasis from the lung to other part of the body, because stage 3 or stage 4, unfortunately, cannot be cured. That's all our talk. Do you have any questions? I'm open for any questions.
Thank you so much, Dr. Wu, for giving us that amazing talk. And thank you so much for taking time out of your super busy day to come inform us about cancer. I guess we'll go ahead and start with questioning. I see that Ethan has a question. Would you like to go ahead and ask Dr. Wu your question?
How much hours do you work a day?
Oh, that's doctor work very, very hard. You know, we see a lot of patients every day. Roughly average about 11 hours to 12 hours a day. Not only that, we have to take a call, right? Because holiday, weekend, each doctor have to be on call because there is a patient probably come to the hospital, you need to take care of. Also, during this pandemic, like the COVID-19 pandemic, coronavirus infection, all doctor, nurses cannot take a day off. You have to go to work because patient need it.
Awesome question, Ethan. And thank you for that answer. It seems like Braden also has a question. Would you like to go ahead and ask your question?
Um, what kinds of cancers do you usually treat?
Good question. Very interesting question. We, as a doctor, medical oncologist, we have two types of medical oncologists. One is called subspecialized. That means they spend a lifetime only see one type or two types of cancer. I'm a general oncologist. General oncology means see all type of cancer from head to toe. I'm sorry.
I think someone's unmuted. Oh, no, it's okay. I actually have a quick question. So, you know how the FDA just approved the Pfizer vaccine for teenagers? Do you think it's safe for teenagers to take the vaccine now, or should we wait for more testing?
That's an excellent question. Keep in mind, this COVID-19 vaccine has been approved by the end of 2020. So roughly somewhere close to maybe about 450 million people, of course, adult, age more than 16 above, received the vaccine for Pfizer or Moderna vaccine. So it's a very large number. Worldwide, large number was collected, large number of patients collected, people collected. There is a data analysis, turned out very, very effective, somewhere close to about 90% to 95%. That with that being said, is talk about adult. The question is about children. So your question is about age 12 to 15. The age 12 to 15, so far, we just started last week. And FDA approved this vaccine based on Pfizer produced the phase 3 clinical trial. The trial numbers is not like a millions number of people. We talk about 20,000 people. So that's a small, still considered large enough to be safe, to be evaluated by FDA, get approved. But overall, the numbers in children still small compared to adult. Adult about 450 million people received. And in adult population has been proven very safe and effective. Use that data translate, plus the children have 100% effectiveness. 12 years old to 15 years old receive the vaccine to prevent COVID-19 infection at 100% effective. I personally believe it's safe for you guys to get it. Additional waiting times always great. but we have to think about, we need to get this disease under control. So this is a risk of benefit balance issue. Personally, I trust this phase 3 clinical data plus adult data, and should be effective and very, very safe for children or teenagers like you guys. But again, we still need to collect the data during the vaccination. All these adult, teenage populations, we have to collect data and analyze and provide safety data, provide effectiveness data. And any time we find there is something potentially can be risky, should be reported right away. That's a good system from America. FDA or CDC have a strong monitor system, surveillance system. That's very, very good for you guys. I'm trust this vaccine, and I do recommend you guys should get it.
Thank you so much. And I think William wants to ask a quick question as well.
Yeah,
Go ahead.
Dr. Wu, thank you so much for coming to our class today and taking so much time out of your own work time to provide us with this educational experience. I just have a quick question. As an oncologist who treats cancer, how do you balance the emotions with working with cancer patients and witnessing life and death? You know that some of them might not make it through, some of them might. How do you balance your emotions in those scenarios?
Whoa, that's a very, very difficult question. It's a very, very great question. Okay. When you go to medical school, after finishing medical school, you're going to go to internal medicine, surgery, become a resident. Like a medical oncologist, you have to do 3 years internal medicine residency. During that time period, you exposed to a variety of different type of patients, right? Heart patient, heart disease, bone disease, brain disease, or infectious disease, also a cancer patient. So honest with you, most of medical oncologists, when they choose become medical oncologist from internal medicine residency, enter into the medical oncology specialty, we call fellowship training. It is kind of a naturally selected route. So you have to understand, yes, my cancer patients, a lot of them cannot survive, but we do provide a lot of help. Not only just inform patient, make a patient or patient family understand the process of entire cancer treatment. And even though patients, some of patients eventually go to the hospice care or palliative care, that's very helpful for patients. You always think about, yes, I'm a medical oncologist, I cannot cure your cancer, but I do provide a lot of support, not only just for family support, patient support, and make patient quality of life better, make patients more comfortable, make patient live longer, and the small number of patients can be cured. With that being said, when you working as an oncologist or cancer doctor, you have to understand, yes, that's my help. I help my patient, I help patient family. So this is very meaningful for a doctor and to provide assistance or helps for the patient. So once you understand that part, you kind of able to separate your emotional to reality or your real work. And it's tough, and particularly when you first time or first few years deal with cancer patients, you see some of the patients have been been follow with you and you know patient family, even kids, grandkids, just like a family. Now you watch the patient reach the point we run out of choice and patient deteriorate to the degree we have to tell patients, say, okay, it's the time to consider hospice care or palliative care. It is very difficult, but during the resident training and the fellowship trainings, all this training process make you, as a functional doctor, able to deal with this difficult time and still able to provide assistance help for patient and patient family. So you need time to training, and you need to understand your support, your help is very important for the patient and family. Hello?
I think there was some echoey feedback. Are there any other questions for Dr. Wu? You can type them in the chat if you don't want to say them out loud as well.
Hi, Dr. Wu, this is Wendy.
Hello?
Hi, Dr. Wu. Question. So, is the Pfizer still effective for this mutated virus thing in India? Because you kind of explained to Brian, and then he drew a picture and trying to explain to my parents. I still don't get it. Thank
I'm
you.
sorry.
Yeah, he explained to us, like trying to tell us, you taught him that, this this vaccine still effective for the mutated virus in India. And he did draw a picture trying to give us like all the information about it, but I still don't understand. Can you repeat it again?
Okay.
Thank you.
This is what happened. Okay. These two companies, right? Moderna company and Pfizer company, they use this technology called mRNA vaccine. They basically make mRNA is a copy coding sequence of one protein called spike protein. In spike protein is the protein of coronavirus. Utilizes spike protein as a key, open the lock, which is called receptor on the cells, called ACE2 receptor. The company, this biologist, are very smart. They're specifically looking these genes and find out, hey, this spike proteins, there is a lot of regions. The gene is a very long sequence, right? Some regions called variable region, some regions is very conservative region. Conservative region means that gene sequence, one segment of gene is so important, you cannot change even single amino acid. If you change single amino acid, that structure of spike protein, S protein, is become completely different. In that case, that mutated in conservative regions causes a structure change of spike protein, not then become dysfunctional, cannot open the ACE receptor, get into the cell. So they use this technology to make sure the conservative region of spike protein has to be exactly same sequence as wild type of coronavirus, COVID-19 virus spike protein. So all these mutations, virus mutation is very common in nature. Okay, when they infect people, host, they're going to mutate, particularly with large populations. The mutations has to be selective. That means some mutation can make virus more infectious. Some of this mutation can make virus more aggressive. But the conservative regions, like a S protein, this is exactly these two companies produces vaccine, use S protein, conservative regions, and make antibody, right? Give to people, people make antibody against the S protein. So conservative regions cannot be frequently mutate. If frequently mutated, the virus itself will be died off, cannot infect people, right? So this is why currently we talk about all these mutations from British, from South Africa, California, and also I think from New York and from India. All these mutations is in the variable regions, does not affect the conservative regions of spike protein, S protein. This is why this vaccine still work, even though they are mutated, but the mutated is not in the conservative region. Our antibody created by this vaccine is exactly target these conservative regions, neutralize the S protein, attack the conservative region. This is why the vaccine so far, these two company vaccines so far still work very well.
Thank you so much, Dr. Wu. So do you think eventually this virus, this pandemic is going to kind of like end if we have enough people to get vaccinated, like a herd community? Like
Most likely,
eventually.
This is very hard to predict. At this moment, we cannot predict eventual outcome. Most biologists or medical oncologists, not medical virologists or infectious disease epidemiologists, they made predictions. Most likely, we're going to end up with have small pocket infection, we call endemic. It's not going to become pandemic. Pandemic means entire global, majority of country, majority of people get exposed to this infection. In the future, most likely by this isolations, quarantine plus vaccine, effective vaccine, different type of vaccines, it become like a small pocket. Let's see, suddenly you find a few cases or 20 cases, 25 cases in Southern California, one of the cities, or maybe next week you find a few cases or small pocket infections. Let's see, 35 people infected in Chicago. It's not going to be like this kind of pandemic, okay? Like the entire world, the entire country. So it's become a small pocket. That's the most likely scenario in the next few years. In terms of new strain, yes, the company prepared the new vaccine. We call it booster. At this moment, they believe maybe once a year or once every 2 years, try to boost up your immune system, because your previous vaccine still create T cell immunities and long-term memory B cells. But we don't know how long this immunity can last. That's what we worried. But so far, looks like they can last at least like 6 months or 9 months. But with new data coming in, let's see, by end of this year, we probably have better data, maybe it's more than 1 year or 1 year. If that is the case, maybe only need once a year booster. And this booster maybe is combined wild type of S protein vaccine plus mutated S protein vaccine. So we can get two basically it's one vaccine have two strain cover for two strain, wild type and mutated one. And once a year or once every 2 years. That will be a very possible scenario.
Good, thank you so much.
Seeing as though it is 4 o'clock, I just want to say once again, thank you so much, Dr. Wu, for coming to inform us on cancer in your field of study, because I know you are probably very busy and this is your day off and you probably don't get a lot of day offs. So I just wanted to say thank you so much again for spending your day off and spending your time here to talk with us. And once again, I hope that everyone else learned something new. With that being said, thank you again, Dr. Wu. And
thank you. It's my honor to talk to you guys. If you guys want to talk to me or have more questions, you can contact her mom. She's a nurse working St. Martin Hospital.
Thank you, Dr. Wu. You're awesome.
Good
All
talk
right.
to you.
Thank you so much.
Thank
Thank you so
you.
much.
Thank you
Bye
so
bye.
much, Dr. Wu. Let's all give him a round of applause.
Yay.
Thank you. Good to see you
Thank
guys.
you.
Thank you.
Bye bye.
If you are in
Bye.
core biology class and didn't just come to hear the talk, please stay for just a minute.
Mhm.
But if you came to listen to
Dr. Wu.
Dr. Wu speak, then you are free to go.
Thanks.
Okay.
So, everyone who is in core biology class, remember you have the craft that you need to make. If you haven't made yet, send us a picture. Congratulations, everyone, you have finished core biology. Over the past 10 weeks, we have learned about cells, their organelles, their structures. We have learned about evolution. We have learned about different diseases and the different body systems. Celine, would you like to continue?
And I'm so glad we got to teach you guys. You guys were all good listeners. You guys took notes. You guys were great interactive students. And I hope you guys all learned something new. And I just wanted to say, even if you guys didn't learn anything at all, we learned a lot from you guys. You guys taught us lots of new things. And I just want to say that we really, really, really appreciate you a lot.
All right. Thank you, everyone, for coming. We hope to see you again sometime in the future.
That being said, I hope you guys have had a great 10 weeks with us. Bye.
Thank you. Bye.
Bye. Thank
Bye.
you.
Bye
Bye.
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 Thank
Bye.
Thank
you.
you so much.
Bye bye.
Bye.
Awesome job.
Bye bye.
Bye and thank you.
Everyone.
Bye.
Thank you.